Hi, welcome back to the channel today. I'm Dr. Gallimore and I just wanted to make a video today. I know we're coming into the winter period and so there's a lot of the winter illnesses around. So I just wanted to give you as our patients an update on a number of the vaccinations that are going on at the moment and a little bit more information about those. Okay. First things first, there's still the COVID vaccination. Now that's not something that surgery books in for yourself, that's centrally booked. So if you are eligible and still have not had your COVID vaccination and want to explore that, it's the centralised 119 number and they can organise getting you that locally. I'll come to the flu again. We've been running a number of flu vaccination clinics already. If you have been unable to get to any of those, we are running a further catch-up flu clinic on the 16th of December between 2 and 5 p.m. If you can call the surgery and select option 5 to book in for that, but if you're unable to do that and it's a last minute thing and you can just turn up on the day, we're also absolutely fine with that. The more that we get vaccinated, the more we protect the community, okay? There are also other sporadic nurse catch-up slots as well. So again, if you call the surgery and select option 5, we'll do our best to facilitate that for you, okay? The next one is a new vaccination this year, which has been the RSV vaccine. This is a virus that can cause most of the time sort of a cold-like symptoms, okay? But adults in the over 75 range are at more risk, and also for pregnant ladies as newborns can be more at risk. So there is an NHS national scheme now for 75 to 79-year-olds who are eligible for the RSV vaccine. We are doing that here at the surgery. So again, if you're in that category and haven't yet contacted the surgery, or you've been notified by the surgery that you're eligible and haven't booked, please do contact the surgery, again option 5, and we will schedule that in for you. It is important as RSV most of the time is a general cold virus, but there are complications certainly in the high risk group such as hospitalisation and pneumonia, which obviously could be life threatening. So the vaccine will reduce your chances of those types of complications. Again, for the pregnant ladies, and this is normally over 28 weeks gestation, it protects you, but more importantly, it protects your newborn prior to their immunisations, because under 12 months, if they were to get RSV, it can be complicated with such conditions like bronchiolitis, which can cause breathing problems, feeding problems, hospitalisation. So by you getting vaccinated, you can protect your little one when they're first born to the best of your ability. Okay. I know I've mentioned a couple of criteria there for patients on the NHS scheme. If you're outside of that scheme and you're apprehensive about RSV, or you wanted to protect yourself or maybe others around you, but you can't access it through the NHS, there are a number of organisations that can deliver private RSV vaccinations, such as pharmacies like Boots or travel clinics such as the Wimborne Travel Clinic as well. So if you were wanting to explore that option, please contact them and they may be able to give you that if you don't fall into the NHS criteria. Okay. Lastly, I just wanted to again bring up whooping cough vaccination. This is pertussis, okay, which is another infection. Now this is indicated for pregnant ladies around 20 weeks of gestation, okay, so 20 weeks of being pregnant. And again, the reason for that is it protects your newborn up until they get their vaccinations when they're born. And that's really important as, again, under 12 months, whooping cough, again, could be mild, but there are risks of hospitalisation, breathing difficulties, dehydration, pneumonia. So by getting that vaccination, again, you protect your little one to the best of your ability. Now, I know the system should work that if you are pregnant, you should be notified by that, but what I'm encouraging ladies who are eligible, who are pregnant for this vaccination is, if you've not heard anything, please contact the surgery to get scheduled in for that. We'll facilitate that to the best of our ability, okay? So that's just a little bit more information about the vaccines, and obviously with the winter period and the spike of these types of illnesses that are going around. Generally speaking, the vaccinations are safe and they have been proven to be effective at reducing either you getting the illness, but certainly the severity and the complications. So as a surgery, we really support, if you're eligible for any of these vaccinations, to take them up. But if you have any further questions or concerns, please don't hesitate to contact to ask us about that. There is also lots of great information on the NHS websites that go through this in great detail as well. So that should be your first point of call. But then if you've got any more complicated questions you're not sure, you can then contact the surgery. Thanks for your time today, and I hope you all stay well during this winter period.